guys. Okay, so I'm going to give you a little bit of information on the written test. This is the paper that I got, and after you pass the exam, they give you a sheet like this, and it'll tell you what you passed and what you failed, but it doesn't give you a score. It doesn't tell you how much you passed. It's just a pass and fail. For the written test, they test you on the role of the nurse's aide, promotion of safety, promotion of function and health of residents, basic nursing care provided by the nurse aide, and specific care provided for residents with changes. Now, I passed everyone except for the role of the nurse aide, and I kind of know which one I got wrong because I wasn't sure what to put. On that one, it was about, something happened in the hospital and there was some coffee spilled on the floor. What do you do? Do you clean it up? Do you get the nurse? Do you call for maintenance? I mean, like, what do you do? I put clean it up because that's what I would do if I see something on the floor. I would clean it up, but I'm not sure if I had a resident with me or not. I'm not sure, but I wasn't sure about that question. It was more questions like that. I mean, it's like little common sense things you would say, oh, well, I'll just go, do it. But that may not be the case. We may not be required to do that because it may put the resident in harm's way. So I really don't know. But they do have sample tests at Prometric. If you type Google Prometric, Prometric, and they can give you their sample test there. That's where I had to register for the test. Now here, just to give you some information on, before I go more in depth with the written test, this is the skills test, and they test you on hand washing. What I got was measure and record pulse and respiration, change of position, nail care and hair care, that's together, and indirect care. Talking to the patient, not treating them like they're some type of object. How are you? Are you okay? Do you need any more help? Can I do this for you? Blah, blah, blah. That's what they test you on because they want to see if you treat the residents with compassion and, care instead of just going in and doing the job and then leaving and making them feel like, what happened? That's kind of like off-putting and it makes people feel bad. So they test you on things like that. Okay, so the written test is kind of like situational. There is no really technical stuff. It's just questions like, what would you do if this situation arises? That's basically what the test is. Now, to tell you guys the truth, I went over that Prometric sample exam, and most of the questions that were on that exam and the other exams that I kind of like took online, if you just type in practice CNA test, you'll come up with a whole, host of information and mock tests. And if you keep practicing with those, I'm telling you, you will pass. I think it's like 60 questions or 70 or something like that. And it takes like an hour to do. They give you 2 hours, but you can do it in less than that. It's really simple and easy, and some of it is common sense, but be careful. Even though it may look like it's easy and simple, they're very tricky because remember, they're testing you on promotion of safety. Now, things that seem normal and you would do it, it may not be safe for the resident. You have to ask yourself when you're answering the question, is this safe for my resident if I do this? If not, you're gonna fail. You're gonna fail some parts of the test because you have to put the resident first. Like they're gonna ask you a question about a fire. There's a fire. There's a fire extinguisher. What do you do first? Do you put out the fire? The answer is no. You gotta go get that resident out of the way, out of the room. Even though the fire extinguisher is right there, and it'll be simpler and faster for you to just put the fire out to protect and save everybody, but that's not what they want. They want you to get the resident up and out of the room, and anyone else that is there in the room, a resident, and then you go and get help for the fire. So they don't care if you burn the place down, just get the people out. It's questions like that, so you have to think resident safety first. Okay? And I think that's about it. The role of the nurse, promotion of safety, promotion of function and health of residents, basic nursing care provided by the nurse aide, specific care provided for residents with changes. That's like if the person had a stroke, what side do you undress and dress the arm? You undress the, what is it? I think you undress the strong arm first, and then you dress the weak arm first. Yeah, I think that's right. When you take off, when you're dressing the resident, you start from the right, strong arm first, and then when you're dressing the resident, of course, you dress the resident with the weak side, whatever side that's on, or the injured side. You dress that first. You know, things like that. You just have to know your skills. And they test you on, okay, what are the signs of, you know, someone with low blood sugar? I think I got that one wrong. You know the signs of symptoms. They're not going to get in depth like if you have arthritis, you know, what is the technical term for that. It's not a nursing exam. They just want you to know basic stuff. So you have to know the signs of low blood sugar. If someone is getting ready to have a stroke or a heart attack, what signs come first? You know, things like that. Okay? So I hope this helps. I'm trying to remember if there's anything else. Don't be discouraged. When you go into your exam, you may find that the people that are there probably failed it the first time. I passed on the first try, thank God, because I really didn't want to go through that. It's so much pressure. It is. I mean, they send you 2 by 2, and it's like you're going in there to die or something. There's just so much pressure, and depending on the nurse, whoever you get to administer the exam, they could be nice, they could be mean, they can, you know, grill you, and that makes you even more nervous. And the nurse that I had, she kind of gave me another chance. When I was doing the nails, I didn't ask the resident or the person that I was being tested with to test the water. So she came by and just dipped her hand in the water. I mean, those are little things, but it's not going to fail you. But that's resident safety. Yes, it will, because if you burn the resident, then, you know, that's a lawsuit. It's trouble right there. So you can't fail on that. But she was nice to do that, and she helped the other girl out before, so I guess that's why she helped me out, because the other girl was going to fail the first part. So she helped her out, and she gave her another chance. So she kind of did that for me too, which was nice. But all of them are not going to do that. So you have to really know your stuff, and just don't be nervous. It's hard to say that, but if you be nervous, you'll forget the little things, and it's the little things that really count, because that's what they're looking for. And she's sitting at the side, and she's just checking and that's making you even more nervous. So what I would suggest is that you practice and practice and practice. If you have to practice 20 times on a doll, on your friend, just practice to get into the routine, because once you start to do it, everything will come to you. So I think that's it, guys. I hope you guys do well. And if you're going on to nursing, don't let this be like your last stop. Keep going, because they don't pay that much. The most you'll get is probably like $13 an hour. You're cute, okay? And the less you'll probably get is probably $8. So it depends on where you live, okay? That sucks, but that's the pay rate, guys. Okay, so I'll talk to you guys later. If you have any more questions, I will put some links to some of the tests that I took online, and some websites that kind of helped me out, and the videos that helped me out. Okay, thanks for watching. Bye.